Hi friends, and welcome back to my channel. In today's video, we're going to be discussing the role as an adjunct faculty member. Should you be one? What do you know about it? How do you get into this role? Pros, cons, everything in between. So I am asked all the time from nurses that work on the units that I take my students to for clinical. I'm always asked questions about how I got into teaching. How do you become an adjunct faculty member? I do have people reaching out to me to ask those kinds of questions, so I figured it would be a great way to make a video and break down what I know. I've been working in nursing education for 9 years. During that time, I have been a full-time faculty member. I've been a part-time faculty member, and I've been an adjunct faculty member, and those are 3 different roles. So today's video is really going to be focused on what it means to be an adjunct, the pros, the cons, and hopefully it'll help you make a decision if you too want to venture into a role in that type of position. Depending on the institution that you are applying to, if you are looking at a diploma program, if you are looking at a degree, like a 2-year degree, an associate degree program, a bachelor's program, a master's program, but depending on the specific type of adjunct role you're looking at, that could obviously change some of the job requirements that the institution is looking for. So in general, to be an adjunct faculty member and work with students in a clinical setting, you first have to have a degree that's higher than the students that you are teaching. This is going to be regulated by your individual state board of nursing and their specific requirements. But it's very, very helpful if you find that you're the type of person when you are at work, you have students on your floor, they're there for clinical. If you know that you enjoy working with them, you love teaching them, you like to answer their questions, pull them with you while you're doing different things with patients, I would probably highly recommend, if you find that you're really enjoying that time that you have with students, to eventually pursue an adjunct faculty position. To be in this role, is there a formal training that you have to have? No. Most of what you're going to learn is going to be through the experience that you get on the job working as an adjunct faculty member. So what you can do, once you've applied and you've accepted a position, you can make the decision if you want to work as somebody who's assigned to a specific type of clinical for the entire semester. Maybe you're going to fill in for a couple clinical days here and there, more like a substitute. Or there's also that option to work in the lab setting where it's very, clinical skill heavy, where you're working a lot with students, maybe for things like skill checkoffs, simulation scenarios. So those are 3 different ways you can kind of get into an adjunct role. One of the really nice things when you're working as an adjunct is if you start to find that one area that you really love working with students, the one course you really like working with the course instructor, if you guys have a really nice workflow together and you're very vocal about liking that role, chances are you're going to continue to work together in the semesters to come. And that's really, really helpful because you'll start to know what that, full-time faculty member, the lead course instructor, what they're looking for their students. You'll know those learning objectives, and you'll get a nice ebb and flow with each other, and it'll be a very cohesive clinical experience. That's not to say that subbing and filling in here and there isn't a fun time, because it absolutely can be. One of the big advantages to doing something like that is you get to work with all different types of students, from the beginning fundamentals of nursing all the way through to critical care nursing. You can really decide, maybe you're not interested in helping with peds clinicals, but you really want to help with OB. Or you know that you just like working with those brand new nursing students that are at a foundational/fundamentals level, compared to somebody who's ready to graduate and is in a critical care course. So you do have that advantage too, where you can be a little more picky about what types of experiences you want to pick up for extra time or subbing. The other thing would be if you're interested in working in the lab setting with simulations, skill checkoffs. That can be great too. Simulations are a really fun way to see students working as a group, putting together, the clinical pieces, the critical thinking, and really allowing them to run the show. I think that's one of the more fun ways to work as an instructor. If you're going to be in a lab, I like to be in a simulation setting where students are taking charge of that situation, and me as the facilitator, I'm kind of sitting back and letting them shine and do their thing. If you enjoy working with students that are practicing a lot of skills like med checkoffs, the IV push, hanging piggybacks, checking an IV, flushing an IV, inserting an NG tube, all of those types of things, You may really, really love working in a skills lab and helping with skill checkoffs. A lot of nursing schools have labs that are open for students even after hours into the evening. So that might be a really nice opportunity if you are somebody who is working a full-time job, but you're looking to get your feet wet into an adjunct role. So let's talk about some of the things I love most about an adjunct, and then I'll tell you some of the things that are more of the cons just to help you make a really good decision. If you know that you have to continue to work in your full-time position to maintain benefits and retirement and all of those things, working as an adjunct, you're not going to be working 5 days a week. So you're usually signing up for maybe a limited or set number of hours throughout the semester. That's a good thing because it allows you to still maintain the balance of your regular 9 to 5 type job to continue with all of your benefits that you're not going to get those types of benefits with an adjunct position. So that's a nice thing. On the educational aspect, I think it's a really great way to start to get your feet wet and decide if you truly enjoy working with students, because some people have this idea of what it means to be an instructor and work with students, and some people have a very disillusioned idea of what that means. But it's a great way to take them out into the clinical setting, work with them in the lab setting, and start to see if you like that idea of being the person to provide feedback. That means, when you're the instructor, some of that feedback is really positive and some of that is more constructive, where you have to identify those areas for somebody to grow on. In my experience, the first couple times you do that can feel uncomfortable, but the more you do it and the more comfortable you become doing it, it'll feel more natural to you in that type of position where you're providing feedback. Another pro to this is you're not tied to all the responsibilities that a lead faculty member has, where you have to be on numerous committees, you're attending faculty meetings, you have to hold, X number of office hours, you're in charge of curriculum changes and accreditation and all of those types of things. There's a lot of responsibility that comes with being a full-time faculty member, but you just have a little slice of the pie, if you will, when you're the adjunct faculty member. I always really loved this position because I got to take those students to clinical, let them do their thing, be with them, help them throughout the day. But then I was done. When clinical was done, that we wrapped up, our day was over. And then I usually had a day or two off in between until I would help with my next clinical group. Something to think about when you are an adjunct faculty member, especially if you're helping with clinical or in a lab, you are going to need to provide feedback to students. So getting used to filling out clinical evals, summative evaluations to determine if they have in fact met the clinical objectives of the course. So I put this under the positives because, again, it's a way to gain experience and determine if you in fact would like to be more, transitioning more to that full-time role. Another advantage to being an adjunct faculty instructor is if you know in your heart that you're really interested in eventually pursuing something full-time in teaching, when you're already working as an adjunct, you're technically an internal candidate. So when jobs are posted, they're typically posted internally before they're ever posted externally. If you're already actively working as an adjunct, you know that you're going to be able to take advantage of when those jobs are posted, as opposed to somebody who's an external candidate. So there's that as well. Some of the things that I loved most about being solely an adjunct clinical instructor was getting to see students in that real life setting, getting to have those teachable moments in real time with real patients, and seeing and allowing them to see real world experience versus what you might read about or learn about from a textbook. So let's talk about some of the cons, because I want to be completely honest with you and help you make the best decision. There are some things that you need to consider if you're thinking about making this adjunct faculty member jump. I have been in situations and have worked for institutions where I have had a nice small cohort of students, anywhere from 4 to 8 students. That's a very manageable, realistic number for me. If you think about it, you're only one person and you need to be at the beck and call of those students. And yes, they're going to work with nurses too, but they're often first looking for you as their faculty member. It's very difficult to have larger cohorts. And I have also worked at an institution where there were 12 and 13 students in a clinical group at a time. I am only one person and I can't duplicate myself enough to be there and be readily available and provide the insight and education throughout the day to 12 and 13 students. So as you are looking at positions or possibly interviewing, it would be highly beneficial for you to have a really solid understanding of what that student to faculty ratio is like when you're actually out on the unit in the clinical setting. It's different to manage various numbers of students in a lab where it's a more controlled environment. But when you're out at clinical, passing meds, doing skills, physically taking care of patients, you need to have a manageable number of students. And 12 to 13 is just an unrealistic expectation for anybody. You could be the best teacher in the world, but you can't be there all day long for 12 to 13 students at one time. Another con when you're working as an adjunct is you have to remember that you're not with those students in the classroom. So sometimes it can be a little bit difficult. I've experienced this, and I've also seen this where people there's kind of a disconnect between the content being taught, the students at clinical, and the person helping with clinical, where they're not even sure where their students are at in the learning process, what skills they're able to do, all of that. So if you're brand new to teaching and just coming into an adjunct role, it can take a little bit, and you have to be patient with the process, but you're going to have to put some time into better understanding the course, the learning objectives, the students, and where they're at in their specific level of learning. For some people, the pay for an adjunct can be a con. So let's break this down, because for some it's a positive, for some it's a negative. Depending on where you work, if you are looking at more of a university type of setting, many of those schools will actually contract their adjuncts, meaning that they'll pay them a set amount over the course of that 16-week semester. So they're paid in it's a salaried position. So that's great, because that does take into account if you're delayed or canceled for weather, you're still paid. All of that backlogging, clinical feedback that you have to provide students with after hours, you are paid for that. Some places are only paying you an hourly rate. And within that hourly rate, that means the time you're physically with the students. So if your clinical is 6 hours long, you're only being paid for those 6 hours. They're not paying you to come in and make your patient assignments for your students. They're not paying you and prepping for a lab and figuring out the assignments and all of that. And they're not paying you when you have to complete all of the clinical evaluations and feedback. That alone can be very, very timely. So it's just something to think about, because I believe some people have this misconception that you make all this money because you're being paid all the time for all these hours of work that you're doing. You just have to be mindful of, depending on where you work, if you're being paid hourly versus salaried, that could be two very different things where you're putting in a lot of extra work and not actually being compensated for that. Another con can be autonomy. While you have autonomy, while you're with your students, you're on the clinical unit and you are their instructor that day, whether it's at the hospital or in the lab setting, when you're an adjunct, you have to remember it's not your course. So you need to respect what the lead course instructor has planned, what their objectives are, the activities they want with students, the clinical packets, the paperwork, all of that. So you are, at the mercy of somebody else's design, which isn't always a bad thing. But it can be if you have this idea in your mind that you're going to come in, do your own thing and do whatever and roll with it, that's probably not going to work with most of the faculty members who are the lead course instructor. That's honestly all part of the job. But I think it just is helpful to know that you're not going to go through classes to learn how to be an adjunct. You're going to grow with your experience over time. And remember, every cohort that you have, it's a different group of students, different ways of learning. Their strengths and weaknesses vary semester to semester, but it's actually kind of fun because you can reflect back on previous semesters and figure out things that worked well, make changes. You'll find some really solid activities that you can continue to apply and perfect in your post-conference, in your pre-brief with your students. So it's really fun because I feel like you are in control as the adjunct for the day at clinical, and you can really set the tone to make it a wonderful learning experience for your students. And a lot of times they just appreciate working with an adjunct, somebody who is different than their lead course instructor, because that person that's different brings different experiences. They have different methods of doing things, and it just kind of spices up the whole clinical process. I hope this video helped to answer some of your questions about becoming an adjunct faculty member. Thanks so much for watching, and be sure to hit subscribe so you never miss one of my uploads. Bye.